EMDR is basically a trauma form where you use bilateral stimulation to process through both sides of your brain. And kind of what it's like is it's like going into a file in your brain where we store trauma, kind of in the amygdala, fight, flight, freeze area, your reptilian brain. And so we work to use bilateral stimulation to process through, challenging memories. And basically, we work on a SUD scale, so we ask how disturbing a memory is for you, and then our goal is to get that to a 0. So like I tell everyone, that's kind of why I say it's like, it'll still leave a scar, right? It won't ever just go away because it's still a memory, but we work to desensitize it so it's not, as impacting to that person. So they might think of it, but they won't have all those trauma symptoms, which could be like nightmares, could be avoidance, could be, flashbacks, things like that. But to start with EMDR, we always have to resource, which means kind of giving you some positive coping skills to work with. A lot of the basic ones are like container, safe place, some allies, things like that. So there's always prep work, and then just depending on the person's level to process through and be in a window of tolerance, meaning they can tolerate those heavy, intense feelings without going outside of that window. Once they're in that window, we can start to do that work. So for everyone, it's different. Definitely don't expect to come get it done in 30 days. It can be a really lengthy process because as I tell everyone, healing's a long journey for all of us, lifetime journey. So EMDR can take a little bit longer, but definitely have seen, with my patients, through my own experience, the benefits of it. Brain spotting is really similar. Brain spotting is actually kind of the same premise. It's going through your eyes though, and utilizing a point. So we actually look for points where maybe your eyes flutter, something's happening for you. An activation point essentially. There's also resource points, so there's resourcing done there as well. But really what we do is the same thing. We work on reducing a SUDS level of an event or memory, but just allowing you to focus on a point. So they're both a little different. EMDR is a little more of this, the bilateral movement, whereas brain spotting is focusing on a point. But really they're both still kind of like that fast track process of going through your trauma and hoping to make it a scar rather than a gaping wound. I'd say EMDR is more widely known, so patients generally come in wanting EMDR or asking for EMDR. Brain spotting is newer, and there's not as much science behind it yet because it's so much newer. However, it's kind of the same premise. So I would say if somebody doesn't do well with EMDR, I will then offer brain spotting, or brain spotting is a little less structured. EMDR is very scripted in what we can do, whereas brain spotting is a little more of just let them go wherever they want in their mind. And they always say like all roads lead to Rome, right? So all roads lead to healing, basically. So for brain spotting, it's a little more of letting them go wherever they want to go, knowing that eventually they'll get to where they need to. I tell everyone it's just wounds, right? And unfortunately, a lot of times the wounds never really get healed. They're kind of, pussy and gross and lead to symptoms like anxiety, depression, substance use, things like that. And so to be able to heal those wounds, right? I always say they kind of leave a little scar, but to be able to heal those wounds, you can learn to move on through life without needing, unhealthy coping skills.